Invite Dr. Prasad for his talk, Dr. Prasad Vaimbe, for his presentation on BYNOCS. Can we think beyond patching?
Good morning, respected judges and audience. I'll be presenting the paper titled BYNOCS, Can We Think Beyond Patching? The last year in SPOCI conference, I presented the data till 1 year. Now I'd be happy to share the 2-year data now. I know no financial disclosures for this. So, well, as you know, BYNOCS is basically a cloud-based dioptic therapy software for binocular vision assessment as well as therapy, and it employs simultaneous and separate stimulation of both eyes using anaglyphs. It has both diagnostic as well as therapeutic models, of which I have used the therapeutic model for amblyopia, which involves the computer-based games designed on dioptic stimuli. So the purpose of the study was to evaluate the effect of this cloud-based dioptic therapy software called BYNOCS on visual acuity and stereopsis of patching resistant and patching non-compliant amblyopes, which were aged between 4 to 17 years. So it was a non-randomized interventional prospective study. 185 children with either anisometropic or ametropic amblyopia were included. The age group was between 4 to 17 years with a mean of 8.4 years and the sex predilection as shown in the slide. The inclusion criteria, they all were cases of either anisometropic or ametropic amblyopia with associated refractive error. They had stable vision and there was no improvement with patching on 2 consecutive visits. That means they were either patching resistant or they were self-reported patching non-compliant, and all were willing to participate in the study. The amblyopes, the strabismic amblyopes or associated ocular or retinal pathology or history of any ocular surgery, all were excluded from the study. Pre-BYNOCS evaluation was done, basically a cycloplegic refraction with a best corrected visual acuity using logMAR as well as Snellen's equivalent. BAC was calculated using TNO, and the patching was discontinued if at all they were doing it. And the post-BYNOCS evaluation, the same parameters were used. The follow-up was done at 1, 4, 12, 18, and 24 months post-treatment. Since it's a cloud-based software, that's why you have to have a good internet connectivity with minimum 512 kbps speed. You can have any desktop or laptop with a minimum 11-inch screen with a Google Chrome browser installed in it, and either Google Meet or Microsoft Teams or Zoom installed in it. How was the therapy session? The therapist and the patient, they connected remotely through the Google Meet or Zoom or Teams. Patient used either red, blue or red cyan anaglyph goggles. One-time calibration of computer for the size and the color as well as for the anaglyph was done. And the 30 sessions of dioptic therapy were given online for 30 minutes per day. Observations, these are the various patient data records. There was an improvement in vision and stereopsis. So of the 185 patients, 105 were male and 80 were female with a mean age of 8.4 years. Pre-therapy, only 22.5% had best corrected visual acuity of 6, 9, and 6, which improved to 35% post-treatment. Post-therapy improvement in distance as well as near vision which was statistically significant using Wilcoxon sign rank test, and also the stereopsis improvement was also statistically significant by McNemar test. So according to me, what were the advantages of this software? Because since it's a cloud-based program, so it can be used as an easy telehealth vision screening as well as therapy program. And importantly, it was useful for patching resistant as well as patching non-compliant patients. Because of its remote use, it was quite useful in COVID lockdown period. And even examiner can remotely monitor the progress of the child. Now, what are the limitations of study? Last year I presented 1 year. Even after 2 years, the results are still the same. It has not deteriorated. It has not, the amblyopia has not resurfaced. But what is going to happen after 2 years, after 5 years, after 10 years down the line, I don't know. So again, second limitation, it still requires a good internet connection and a desktop or laptop, which can be still a distant dream for remote villages. And efficacy as a primary treatment, we don't know. So to conclude, best corrected visual acuity as well as stereo acuity improved after BYNOCS dioptic amblyopia training and remained stable in patching resistant as well as patching non-compliant subjects aged 4 to 17 years with anisometropic and ametropic amblyopia 2 years after cessation of treatment, and it requires long-term studies to prove its usefulness as a robust amblyopia treatment option. Thank you for kind attention.
Thank you, Dr. Prasad. So at the end of 1 year and now, I mean, at the end of...
Yeah, it's still statistically significant. Although some of the patients, the vision has dropped down, but it's not statistically significant. So the the statistically significant improvement is still there after 2 years. I have the data of almost more than 500 patients, of which 185 only I could include because of their longer follow-up.
So you are prescribing, I mean, suggesting BYNOCS as the primary treatment, or
I don't know.
only for
I think it will require head-to-head trial.
Okay. So, I mean, what was your experience with in the refractory amblyopias? I mean, those who did not respond with patching?
The same patients I included.
Okay, only those patients you have included.
Yeah.
All together.
Yeah, that will be very interesting to see then.
Oh, okay.